Welcome to Case Study Series in Business Ethics Case Study by Skilled MBA. The Mosquito Network case study delves into global health governance, focusing on collaborative efforts to eliminate malaria deaths in Africa by 2015. It examines ethical challenges, governance structures, and leadership approaches in this ambitious initiative, highlighting the complexities and strategies involved in tackling this critical health issue. Malaria claims nearly 1 million lives annually, predominantly in sub-Saharan Africa. Tragically, children under 5 are the most affected. The global health community set an ambitious goal to reduce malaria deaths in Africa to 0 by 2015, highlighting the urgent need for effective interventions and resources. In the developed world, malaria was effectively eliminated post-1969 through comprehensive public health measures and sustained economic resources. In contrast, sub-Saharan Africa continues to suffer due to limited healthcare infrastructure and economic constraints, leading to high mortality rates, particularly among vulnerable populations. A complex multi-stakeholder approach is essential in combating malaria. Local community health workers implement prevention and treatment programs, while national programs tailor initiatives to local contexts. International organizations, like the World Health Organization and the United Nations International Children's Emergency Fund, provide coordination and resources. Non-governmental organizations and private foundations offer on-ground support and funding, while pharmaceutical firms develop treatments and preventive solutions. Key global initiatives have shaped malaria control efforts. The Rollback Malaria Partnership, launched in 1998, coordinates global action. The Global Fund, established in 2002, mobilizes resources for prevention and treatment. The United States President's Malaria Initiative targets high-burden countries. The United Nations Millennium Development Goals integrated malaria into broader development, fostering political momentum and accountability. Coordination challenges arose from multiple organizations working at various levels, leading to duplication and inefficiencies. Communication barriers between global, national, and local actors exacerbated these issues. Solutions included centralized tracking mechanisms, regular stakeholder meetings, and dedicated coordination offices. Standardized reporting frameworks were also implemented to ensure unified measurement and improve collaboration. Funding and accountability challenges arise from competing priorities between philanthropic and state funders, leading to disputes over resource allocation. Transparency issues complicate tracking fund distribution, especially in resource-constrained settings. Measurement challenges include inconsistent data collection and disagreements on success indicators, complicating efforts to align global strategies with local needs. Global strategies offer standardized approaches and economies of scale, yet must adapt to local contexts. Balancing global frameworks with local expertise builds trust and ensures effective implementation. Community-based solutions and indigenous knowledge are crucial for sustainable capacity and ownership, fostering a collaborative environment that respects cultural practices while achieving global health goals. Collaborative entrepreneurship unites diverse sectors to achieve 0 malaria deaths by 2015. This approach fosters a shared vision, coordinated strategies, and cross-sector innovation. By combining resources and expertise, it enables local adaptation with global support, enhancing impact and sustainability in malaria eradication efforts. Addressing malaria is a moral imperative, highlighting the ethical duty to protect vulnerable populations. The preventable nature of malaria deaths questions global responsibility and health equity, exposing stark inequalities in resource allocation. Pharmaceutical companies face the challenge of balancing profit motives with their obligations to developing markets, emphasizing corporate responsibility in ensuring access to essential medicines. Systems thinking in malaria control involves creating innovative tools and treatments, ensuring efficient production and supply chains, and delivering resources to remote areas. Education and training enhance local healthcare capacity, while monitoring and evaluation refine strategies. Success relies on a networked approach, emphasizing interdependence and trust among stakeholders. Leadership in global health requires boundary spanning to connect diverse stakeholders, bridging institutions and cultures. Leaders must build consensus without formal authority, balancing interests of funders, implementers, and communities. Sustaining momentum is crucial, especially amidst political changes, to ensure long-term engagement and success in addressing complex health challenges. Decentralized governance offers flexibility but risks inconsistency in public health responses. Ensuring accountability requires clear metrics and transparency across diverse actors. Ethical leadership demands that wealthy nations and corporations address inequality proactively. Narrative power is crucial in galvanizing collective action, shaping perceptions, and driving engagement in global health initiatives. The Mosquito Network exemplifies how ambitious goals necessitate intricate partnerships. Addressing global health challenges requires coordinated action across borders, sectors, and institutions. Complex problems demand solutions that integrate diverse expertise and perspectives. Ethical leadership is crucial, as saving lives relies on effective governance and coordination alongside medical advancements. Thank you, and the Mosquito Network exemplifies how ethical leadership in global health governance is crucial. Effective governance and coordination are as vital as medical interventions in saving lives. This case study highlights the importance of shared responsibility and collaborative innovation in addressing complex global health challenges, emphasizing the need for diverse expertise and perspectives.